Hello, ladies and gentlemen. Welcome to Health Educational Program. My name is Aisha Sani.
My name is Aisha
I'm a nursing
Sani,
student
and I will be discussing some
and
topics.
today's topic
to
is
you
going to
today
be on breast cancer awareness. Today, PAR action is breast cancer awareness. The topic is going to be a leadership in breast cancer awareness. So let's. My objective today are to teach learners how to understand the influence of nursing leadership on belief, attitude, feelings, and behavior within the population. Learners will also appreciate the reason as to why self-breast examination and yearly mammogram is important, to appreciate the value of precipitate action research in a clinical practice and leadership influence, its applicable and effectiveness. My objective today are to teach learners how to understand the influence of nursing leadership on beliefs, attitude, feelings, and behavior within the population due to breast cancer. And learners will also appreciate the reason as to why self-breast examination and yearly mammogram is important to detect for early detection of breast cancer. Also, for community population to understand the various techniques for self-breast care examination to provide help and inspire hope through early detection, education, and support service to assist and how to assist your personal skills to know how to look for signs and symptoms of early detection. My outline as follows. To understand symptoms of breast cancer, the importance of breast cancer examination and breast self-examination, leadership role in community, impact of nursing in the community, and the value of PAR in community health. So the outline is understanding symptoms of breast cancer, the importance of breast examination and breast self-awareness, leadership in population focus, community health, the impact of nurses in our community, and the values of PAR in community health. So this is a brief explanation how to perform self-breast examination. Self-breast examination is normally performed when last menstrual period, the same day, the same time, to determine consistency. So to perform a breast self-examination, place the pillow under your right arm behind your head. Using the left hand, move the pad of your fingers around your right breast gently in a small circular motion, covering the entire breast area and armpit. Use light, medium, and firm pressure. Squeeze the nipple, check for discharge and lump. Also notice that when you check for lump, sometimes it might not be related to cancer, but it's better to notify your primary care doctor, because not every cancer can be found. Not every cancer can be found this way, but it is a critical step for individuals to take. Talk to your doctor about your breast cancer risk. Knowing family history down the line could help detect and early treatment of breast cancer. Get mammogram regularly can lower the risk from dying from breast cancer, and it is recommended to get biannual mammogram checkup between age of 50 to 74, and those are because breast cancer are mostly detected around that age, 50 to 74 years or so. It is recommended for your annual mammogram. The importance of leadership in healthcare. Leadership is fundamental in assessing the needs of those prone to breast cancer. It is important to have a clinical breast exam at least every 3 years starting at the age of 20 and every year starting at the age of 40. As for those who are prone to breast cancer, such as those who have family history of breast cancer, um, or those for familial breast cancer, they could have an early detection. So after the age of 40, it is advisable to get mammogram done every year to to be able to monitor the growth of the lumps in the breast and for early treatment. Leadership in population focused community. It is important for the nurses to appreciate the value of interpersonal skills in achieving high potential and encouraging healthy lifestyle. Encouraging the by We encourage the community in maintaining a healthy weight, adding exercise into our daily routine, limiting alcohol intake, and limiting menopause hormone use, and encourage breastfeeding. All these factors will minimize the risk of breast cancer. So it is important to follow a healthy lifestyle. Some great impact that nurses have in our community are as follows. The aspect of the nurses in enforcing self-breast examination to the community due to lack of sufficient motivation to perform it on a consistent basis. So we need to continue to educate our community the importance of consistent basis on self-breast examination. It is evident that culturally positive styles in nursing has a great impact to motivate women to perform breast self-examination because of their knowledge and their supportive educational role. So we need to continue that motivation. Some of the technique can be nurtured, including leadership by walking around, monitorship, and consistent education. So we nurses need to continue to advocate the importance of self-breast examination and early detection. The the impact of nurses in our community. Nurses have a good impact for individuals. So due to that, nurses need to reinforce self-breast examination to the community due to the lack of sufficient motivation to perform on a consistent basis. So we need to educate the community of importance of breast self-examination on a consistent basis. That will be able to have a chart and know what is regular and what is irregular when you're performing your breast examination. Also, we need to teach individuals on different techniques on how to examine your breast, and by doing so, as a nurse, including our leadership, we could go around, walk around, we could do monitorship and consistent education to the individual, to the community, because all this will help lower breast cancer because 1 out of 4 women in the United States are diagnosed with breast cancer every year. So all this will help for early prevention, and it would decrease the death rate of breast cancer. The value of PAR. PAR is gaining more popularity in the field of the healthcare since it offers an alternative way of enhancing nursing care to a particular population, such as my PAR as breast cancer awareness. Every day we find a better way to improve breast self-examination for early detection, so which will help decrease death rate due to breast cancer. And recently we were having lower death rate due to early prevention. Pre and post tests, and these are the pre and my this is my pre and post test. What is PAR, which is the breast self-examination? Define breast self-examination. How do you perform breast self-examination? What steps to take upon further self-breast examination? Why should nurses enforce breast self-examination? How to make healthy lifestyle choices in early detection of breast cancer? What is the place of leadership in population focused community healthcare? What kind of leadership style are applicable in healthcare? What are some of the steps that encompass PR circle? How PR improve nursing care when used collaborative with leadership? How can a nurse practice leadership in recommending regular mammogram for breast cancer prone individuals?